Good day everyone, my name is Kenneth D. Velasquez, a student nurse from Davao Doctors College, Section 12A, and from the group of 24. So today I will be performing my return demonstration for cardiopulmonary resuscitation. So immediate CPR can double or triple the chances of survival after a cardiac arrest. It helps keep the brain and other vital organs alive during cardiac arrest by pushing oxygen-filled blood throughout the body. So first, let's assess adult patients. So for the assessment and activation, assess the patient if they are responsive or not. Because a person who is responsive will move, speak, blink, or react at some way when you tap him and ask if he is okay. However, if a person is unresponsive, you observe that he is not breathing and does nothing when you tap him and ask if he is okay. First procedure is that we will be shouting for help. Sir? Sir, are you okay? Sir, are you okay? The patient is unresponsive. Somebody help me. Please help me. Next is we will be checking the pulse and breathing simultaneously for us to determine if there is a pulse present. And here, this is the carotid pulse. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. So, there is no normal breathing and pulse felt. Next, activate the emergency response system and send for AED for us to help the heart re-establish an effective rhythm. You in the maroon shirt, please call 911 now and please send me an AED as soon as possible, please. And now we will be turning the patient onto his back and place him on a flat, hard surface. So now I'm checking for debris. So the patient is now safe. Next is high quality compressions. Here, the hand placement on the lower half of the sternum by putting the heel of our dominant hand in the middle of the chest. I'm left-handed. And put your non-dominant hand on the top of your non-dominant hand and elbows locked. So here, 30 compressions in no less than 15 and no more than 18 seconds. Compress at least 2 inches or 5 centimeters and complete recoil after each compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So for the adult breaths, we will be giving 2 breaths with a barrier device. This is an improvised, and each breath given over 1 second. Now here, tilt the head and lift the chin. And then pinch the nose shut, then blow for 1 second each. So here, visible chest rise with each breath, and we always have to remember to watch for the chest to rise as you give each breath. So, we will be resuming compressions in less than 10 seconds. Resuming compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Lastly, the AED, or the one they called automated external defibrillator. First, we need to power on the device or the AED. So this is a machine that can deliver a shock to allow the heart work properly. Correctly attach the pads after. So here, we have to clear for analysis because for evaluation of the heart rhythm, we need to stand by and prepare to shock. We always remember to do not touch the patient and let the AED analyze. Everyone, move away from the patients and do not touch the patients, including me.
Do not touch patient. Analyzing heart rhythm. Please wait. Do not touch patient. Analyzing heart rhythm. Please wait.
So if the AED says start CPR now, start compressions immediately. Clear to safely deliver a shock. And here we have to do 30 compressions and 2 breaths simultaneously.
Press the patient's chest down rapidly, 1/3 depth of chest, then release. Start CPR. Press, 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 press. Stop compressions. Give breath. Give breath. Continue with compressions. Press, 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 press.
So here, as you can see, we have safely delivered a shock. And do not always forget to switch roles every 2 minutes or after every 5 cycles. And we always have to remember to practice good team dynamics with your members here. Now let's proceed assessing pedia patients. So when performing CPR on an adult, you likely have to use full lung strength to administer effective rescue breaths. However, with children, the breaths should be much gentler, and with infants, they should be gentler still. First, make sure the scene is safe. So as I can see here, there are no any signs of dangers. We can proceed. First is we have to open the airway and check for breathing for up to 10 seconds using the look, listen, and feel method. Here, we will be assessing if the patient are responsive or not. We will also be turning the child onto his back and place him on a flat, hard surface. So as I can see here, there are no any signs of debris, so the patient is safe. For assessing the open airway, our left hand at the head and right thumb at the chin to open the patient's mouth. So here, since I'm left-handed, it's vice versa. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. So for the listen part, we have to clap our hands and see if there is any reaction. There are no any. And for the feel part, we will be tickling the feet again to see if there are any reaction. So there are none. If not breathing, of course, we have to give 2 rescue breaths, 1 to 1.5 seconds each. And remember, we have to give 2 rescue breaths using the barrier device. Also, we have to check the victim for signs of circulation. I will be checking the lips and the nail beds. And also, we have to check the O2 saturation. And upon checking, the child have 92%, which is below normal. And upon checking also the lips and nail beds, the patient is cyanotic, meaning there are no any signs of circulation. And if there are no any signs of circulation, we have to proceed doing the CPR or the cardiopulmonary resuscitation. And for the child, we have to pull one hand in correct position for the chest compression. So since my left hand is my dominant, I will be using this one here. And then give 30 chest compressions in 1 to 1.5 inches deep at a rate of 100 compressions per minute. And here we will be continuing 5 cycles of compressions and 2 rescue breaths per cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So after 1 minute of CPR, pause and check the patient for any signs of circulation. Look, listen, and feel again. So as I can see in the lips, it is turning normal. The nail beds are turning normal. And the patient is slightly reacting. Now we will be putting the patient in a recovery position, just like this. Gently and slowly. And then we have to document the time the procedure started and the time of the recovery. Now, documenting is important because it communicates clinical information about a client, including data related to their state of health and illness. So let's proceed in assessing the infant CPR. First is to assess, and here we will be checking for response and for no breathing or only gasping at least 5 seconds but no more than 10 seconds. Tap the baby and shout to attract attention. Baby, baby, are you okay? Are you okay? The baby is unresponsive. Please, someone help me. And here we will be checking the breathing simultaneously by opening the airway and lifting the chin. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. No normal breathing. Send someone to activate emergency response system.
What happened?
The baby is unresponsive and he has no normal breathing. Please activate the emergency response system and please bring me the AED as soon as possible. Here we will be checking for the pulse, no more than 10 seconds to determine if there is a pulse present. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. No pulse assessed. Here we will be giving the high quality CPR. First is to correct compression by placing our finger. Next is second, the adequate rate at least 100 compressions per minute and start CPR. Here we will be compressing the chest 30 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So after 30 compressions, open the airway. If you see an object in the mouth, take it out. So there are no any objects. Let's proceed. Third is for the adequate depth. Delivers compression at least 1/3 the depth of the chest, approximately 1.5 inches or 4 centimeters to be exact, and also allows complete chest recoil. Here, repeat giving sets of 30 compressions and give 2 breaths after. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Check the mouth also for objects after each set of compression. As I have said earlier, there are no any objects, we can proceed. Cycle 5, or the 5th step, minimize interruptions. Give 2 breaths with package mask in less than 10 seconds. Are you ready to switch roles after this?
Yes. Everybody clear?
Clear.
Shock advice. Shocking only 1, 2, 3. Begin CPR.
Of course, during the 5th set of compressions, second rescuer arrives with a bag mask device and rescuer switch roles here. Both rescuers resume high quality CPR and the second rescuer will be giving 15 compressions in 9 seconds or less by using the two thumb inserting hands technique for 2 cycles. This produces higher coronary artery perfusion pressure and also results in more consistently and appropriate depth or force of compression. If you cannot physically encircle the victim's chest, compress the chest within 2 fingers. And me, of course, after this, me as a first rescuer has successfully delivers 2 breaths with bag mask for 2 cycles. After 2 cycles, prompt rescuers to switch roles. Are you ready to switch roles again with me?
Yes.
So both rescuers will be resuming high quality CPR here. And me as a first rescuer will be giving 15 compressions in 9 seconds or less by using 2 thumb inserting hands technique for 2 cycles. Then the second rescuer will successfully deliver 2 breaths with bag mask for 2 cycles. With the second cycle, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5. So that will be it for the basic life support. Thank you for watching.